Hi, and welcome to Ask Dr. B. I had a question come in from a viewer, and the question is, how do you manage anxiety without medication? That's a great question. Anxiety is a huge topic, and so I'm going to break this topic up into chunks, the way that I've done for other topics that I've covered. And in this video, I'm going to talk about really what is anxiety? How do we think about anxiety? What are the categories that those of us in the mental health field, how do we think about what people are experiencing? And the reason we do that, this show is, as hopefully you've seen, it's not about diagnosing or labeling. It is about understanding. And so we humans categorize things. It helps us make sense of them. It helps us talk about them. It helps us study them. So that doesn't mean that if you hear me talk about a cluster of symptoms or presentation in some way, maybe some of that sounds like you, but not all of it. That's fine. This is just the way that we categorize and think about conditions that we humans deal with so that we can address them better, learn about them, and hopefully all lead healthier lives. So, and if I didn't mention it, which I'm not sure if I did, then I'm going to talk about medication a bit and, why it's recommended or when to consider it and all of that. But let me first start with anxiety. What is it? First of all, anxiety is something that we all experience. It is a normal experience of humans. We would all be in trouble if we didn't experience anxiety, because anxiety is something that we experience when there is a real or perceived threat. You probably remember learning about, the fight or flight response, and there are other actual responses that one may take in response to anxiety, but those are two that most people know about. You either fight when you feel a threat or you flee. And so your body goes into motion. It starts to change the way you breathe, and you feel, ready to spring into action, whether you're going to fight or flee. So it's a very normal, understandable human reaction. Unfortunately, sometimes anxiety shows up when there really is no real threat. We may perceive it to be a threat, but it may not in fact be a threat, or it may not be a threat at the level that we are experiencing it. And so this notion, it's really important to understand that, again, it can be a perceived threat. It can be a worry that something is going to happen, or how others might respond to me, or I'm not going to be able to accomplish something, or it could be, fear for my life. And it could be operating at a conscious level where we're aware of what that fear is about. It may be that something happens and triggers. I use that word a lot because it's so helpful to think about. I could be walking along and not even know that something is triggering a memory or an experience I've had that then could stimulate that anxiety. It's especially true for people who have had trauma. So it could be a real threat in the environment, could be a perceived threat, and our anxiety could be mild, moderate, or severe. And we know that actually a certain amount of anxiety actually helps us perform certain tasks better. That's been studied. And we know that being a little jazzed, you can think about when you're getting ready for an exam, if you have absolutely no anxiety at all, and you don't feel any level of concern, you may not do very well on that exam because your brain's not engaged, you're not focused. But again, anxiety can overwhelm us, especially when it is in that extreme. It's very uncomfortable when we feel that level of anxiety. So in this video, I'm going to talk a little bit more about what it is. And then in future video, I'm going to talk about what we can learn to do, how to manage anxiety. But it's really important that we understand that it is part of being human. And some of us run a little bit more anxious than others in terms of our disposition, our tendencies. Some of us may worry a bit more in general than others. None of that is bad, or none of that is a fatal flaw in terms of our ability to manage our life, to be productive, to lead happy lives, and to thrive. But again, if it feels distressing to you, excuse me, then that's something that we want to help with. So, as I said, there are categories that we think about in the mental health field to understand what is somebody dealing with. And these are all categories that really fall into, what are above and beyond what would be comfortable or acceptable for the person experiencing the anxiety. We have all, as I said, had anxiety, and some of us have had intense anxiety at certain points in time, but we typically diagnose or basically categorize someone as having this kind of condition, or you might hear it referred to as a disorder, if it is interfering with your day-to-day functioning, and some other qualifiers that I'll talk about as well. So there's what we refer to as generalized anxiety, which is basically an experience where someone has sort of chronic anxiety, and it's worry, it's tension, it's a level of distress that they feel much of the time, whether there is a real threat in their environment or not. And it's, again, very uncomfortable. It can interfere with sleep, can interfere with concentration. All of these that I'm going to talk about will interfere with those aspects of our day-to-day life. There's also something that you probably are familiar with, obsessive compulsive disorder, and what that refers to. The obsessions are unwanted thoughts that keep replaying. Sometimes you'll hear people talking about those as ruminations, and you can't turn it off. And again, most of us can relate to this and say, yes, I've had that. Sometimes when I'm really worried about something, I'll wake up in the night and people talk about, the squirrel cage is running, or they just can't stop that tape going in your head. And then the compulsion is a behavior that you feel compelled to do, like a ritual. The classic one that people often think of because of it's been portrayed in plays and movies and stories is hand washing. But there are many, many rituals. Counting, anything that is done repeatedly with the idea that it might help stop these unwanted, uncomfortable thoughts, ruminations. So that's an obsessive compulsive disorder. Panic disorder is an experience of intense, extreme anxiety. It spikes, it's acute, it's intense. It feels like you're having a heart attack. There are all sorts of physical symptoms. And in fact, a lot of people actually end up in the emergency room with a panic attack because they can't tell, am I having a heart attack or is this a panic attack? Very uncomfortable, very intense experience, chest pain, heart palpitations, shortness of breath, dizziness. There's also a condition that in the work that I've done with our veterans and our service members, I have a lot of experience with, and that is post-traumatic stress. So that anxiety condition occurs when someone has experienced life-threatening, or they perceived it as potentially life-threatening or graphic, horrific trauma. And then that level of anxiety may be chronic, or it may come in spikes when something triggers a memory, a feeling, an experience. So that's another one of those categories, post-traumatic stress. And then there's social anxiety, social phobia, where people feel a hyper sense of self-consciousness. They're uncomfortable in groups, at its extreme. Social phobia can really prevent people from going outside. And there's another condition called agoraphobia, where people are afraid to leave their homes. So these categories are important for those of us working with people who are suffering, because it helps us think about what techniques, what treatments, what programs might be most helpful. And then there's some others that I just want to touch on that people might be also aware of. Performance anxiety, which may be that you're normally, not experiencing a lot of anxiety unless you have to perform a task or a duty. There's fear of abandonment that, again, may not really show itself unless you're in a relationship, and then the sense of anxiety can be overwhelming. And we see some of these signs that I've been talking about, and can be, again, debilitating. And you may become someone that you're really uncomfortable being, very clingy, controlling, fearful, terrified of being left, of being abandoned. People have fear of heights. They have fear of flying. John Madden, the football legend, had a fear of flying. And so he went game to game in his RV. Now, I don't know if he ever addressed that. I just remember that from years ago. He would talk about that. So these are very important categories and ways to understand the cluster of symptoms, how it's expressed, what triggers it, so that we together, those of us who are experiencing these things and those of us who work in this field to help people find ways to manage their anxiety. It's an important way for us to categorize and understand so that we can be helpful. So I'm going to actually stop there and take a pause, take a breath. I'll be back in another video to talk about this issue of medication, when to consider it, why to consider it, how to think about the severity and the intensity of what you may be experiencing. And we'll see where that one goes and how much time that takes. Because I like to chop these into manageable chunks so that you can watch them when you have a little break. And then there's usually, if it's a longer topic, there'll be a second or third one. And you can then take those and watch those when you can. Thank you for this question. I'll be back with more information about it. And I look forward to answering more questions as you all keep sending them in. Take care.